Hi, everybody. Dr. Maria Sampalis here. Thank you for joining Facebook Live. Today I have the pleasure of Jeff Todd from Prevent Blindness. He's the CEO. Hi, Jeff. How are you?
I'm terrific. How are you doing?
I'm doing good. How is Prevent Blindness done now with the COVID pandemic?
It's been an interesting year, as it has for everyone. I have to say, overall, though, we've done much better than I had anticipated. We've been able to be flexible. We've had really great partners who have really stepped up and provided additional funding to support our work and have allowed us to really go with the flow. We've changed some of our programming to make it more accessible virtually. Some of the trainings that we've been able to switch those to online. Certainly some of the direct service that some of our affiliates and local partners do, such as providing vision screenings, those sorts of things, have been challenged, and some of them have had to be delayed or stopped altogether. Certainly schools, don't allow people in at the same level that they had before. So that's been challenging. But overall, it's been a strong year for us. As I say all the time, just because COVID came along doesn't mean people don't need eye care. It's a challenge to reminding them that they still need to get in and access eye care.
Yeah. Prevent Blindness has been around since 1908. Can you tell us about the organization's history?
Sure. We have an interesting history, actually. We were formed back at the turn of the century around a very specific issue, and that was to eradicate a form of infant blindness that was very rampant in the late 1800s, early 1900s. It was a form of blindness called ophthalmia neonatorum, where children were born, and because of a form of it was actually a form of chlamydia that the mothers had that was very rampant back then, would catch an infection in their eyes, and then they would go blind from it. And there's a very simple treatment today. When children are born, they get a drop of antibiotic in their eyes that treats this condition. Well, our organization spent the first decade of our being advocating for these eye drops across the country in every state. And so that's how we were founded. Since then, we've gone on to become everything eye care. We do everything from children's eye care to adults. We focus largely on issues of major public health concerns such as diabetes, glaucoma, cataracts, children's vision, macular degeneration, but we really do touch on everything related to the eye.
Yeah. What areas is a big focus on today with the organization? I know you guys do a lot, but what's the big focus right now?
That's one of our challenges is really focusing in on one area because there's so many needs out there. Certainly educating people who have diabetes about the importance of getting eye care and getting it to their eye doctors is a big area of interest for us, as is children's vision, ensuring that all children have access to eye care before they get into school. It's a shame in this country, everyone should be able to have a pair of glasses that just should be a given. And it's sadly not. There are too many out there that go unmet with this need. Yeah. So those are two big areas.
Yeah. So what do you do for public health advocacy in this space? Is it more towards like children, or is it general population?
Mm-hmm. Yeah. To back up a little, we really have three pillars of work that we work in. The first one is public education and awareness. The second one is public health empowerment. I can come back to that in a minute. But as it relates to advocacy, public advocacy, it's really across the board. Wherever there's an interest, there are two areas that we're really focusing on right now. One of them is just increased funding. There's very little federal funding that goes to eye care. It's pathetic how little funding comes into eye care when you consider the amount of dollars that go to other health conditions. So we're trying to increase those dollars so that more programs and more surveillance of vision problems can be conducted. Beyond that, we try to be active in coalitions so that anywhere that health is an issue, that eye care is inserted as a part of that. So we make sure that if there's legislation that's being passed, that eye care is on the table.
So what about vouchers? You guys have voucher programs. What can you tell us about that, and how can optometrists get involved?
We do. We work with a couple of our partners. The SP Optical's one site is another. We have a couple others that are in the works that provide us vouchers that we can share to people in need when we identify someone that needs eye care. Again, as I mentioned before, there's a big access problem in this country, and even for those who technically probably could afford eye care, it's not the top of their list, when they're trying to feed their families, and especially in this time of COVID. We have access to vouchers that we provide patients who we identify, and so any program across the country is eligible to access those. They just need to reach us, and we can connect them to the voucher system. And we, really value the optometrists across the country that accept those vouchers and participate in the program.
How many vouchers have you given out over the last year?
We average around 10,000 per year across the country.
Wow.
Yeah, which correlates to close to $1 million in eye care.
That's great. That's making a big impact. I mean, that's a lot. That's amazing. How does your organization work with eye care professionals? How can ODs get involved? This is such a good cause. ODs should get involved.
I think we have such a wealth of resources on our website, educational resources, and so certainly ODs are more than welcome to download those resources, use those. They're all written in very patient-friendly language, and so getting the word out about, we often get calls from patients who've been to the eye doctor, and unfortunately, and you're probably aware of this, unfortunately, many patients are afraid to talk to their eye doctors, especially right at the beginning. And I'm not talking just eye doctors, I'm talking about doctors in general. There's kind of a fear of asking questions to doctors because they don't want to take up your time, or frankly, many times, especially if it's a heavy diagnosis like glaucoma or something like that, they don't know the questions to ask until they get home. And then they look for resources online, or they come to us. And so we always try to educate patients about how to talk to their eye care professional, and to be comfortable with their eye care professional. But most importantly, it's about providing them information. We also have a number of other programs. We have a glaucoma community that brings together patients who have glaucoma. We have a website called Living Well with Low Vision that provides resources to those living with low vision. We have an AMD resource. There are all sorts of different resources. So the more that people can help drive traffic to our website or to our social media channels, the better. And then certainly we have affiliates in a handful of states. Those can be found on our website. In those states, there are opportunities for optometrists to become more active locally with them.
Yeah, that's great. That's good information. Because I think patients, if they're looking for something like this, they'll ask the doctor. So it's good for doctors to have this information and know what resources are out there for patients.
Yeah.
In the past, I know you guys have done like a golf tournament. This year, you guys doing a swing foresight in Orlando at Expo East instead of West. Tell me about that for doctors that are going to East this year.
Yeah, well, we're certainly hopeful. East was canceled last year, and this year it was moved from New York to Florida. And we, we're hoping there are a lot of golfers out there and a lot of doctors who like to golf, and it may be the first opportunity they've had in more than a year. And, we'll be in Florida, sunny Florida, and hopefully it'll be a beautiful day and a great opportunity to raise money for a great cause. And so anyone can go to our website and find out how to join in and join that event. And we'll also be having an event at West. It's more of it's a person of vision dinner honoring. This year we're honoring Mark Ferrara, who's with Jobson Optical. He's a terrific guy and well worth this honor. So certainly optometrists can join in that fun as well.
Yes, I know him very well. What about in July? I know you guys celebrating 10th annual Focus on Eye Care at the Health Summit.
Yeah.
How do doctors get involved with things like this?
The summit is a terrific event. As you mentioned, we've been doing this for years. It's historically been an in-person event that we held in Washington, D.C. as part of our advocacy days. Last year, because of COVID, we turned it into a virtual event, and we actually doubled the number of people that were able to participate. And so this year we're doing virtual once more. And, certainly it's open to anybody, and there's so much information. We're having as one of our keynotes, Dr. Michael Chang, who's the new head of the National Eye Institute, will be speaking. And we have a whole host of presenters. And it's just a great way to it's a 2-day event this year, and to spend some time and learning about public health and vision. This summit isn't about research or advances in eye care specifically. There are other conferences that do this. This is really about public health and how we get vision care to those who need it in the country. The nice thing about it is we certainly know you doctors are very busy during the day, but it will be recorded and you can watch it anytime. You don't have to necessarily just watch it live.
There's a lot of great information. Any other information you can share with our audience today about your mission and any other ways that doctors can get involved if they have time, if they want to donate, things like that?
Yeah. Again, I hate to keep repeating myself on this, but I think that our most valued resource is our website. So, and there's so many opportunities to get involved through the website. Absolutely, we value any donation we get. So, dollars help drive our mission, and just being of service. Finding opportunities within your own communities where there might be need for care, and connecting to us, and finding programs in your community that might already be working to provide care to patients. Many of the school nurse associations are already involved in voucher distribution, and many of them are looking for doctors to help connect to eye care. There are so many other community-based organizations that do eye care work, and helping connect them to us so we can distribute more vouchers in those communities is great.
Yeah, thank you so much for joining us today on the Facebook Live event. I provided a lot of great information to help doctors get involved, whether it's doing eye exams to help, or donations, or being involved in the industry, or even public information out there for people to get eye exams and resources to help with a lot of their issues. Mm-hmm. And it's unfortunate that optometry or eye care hasn't been a big focus out there in the public with resources. And I think Prevent Blindness is a great way to get more information out there to the public, and doctors can get involved, right? Because we're all looking to better serve our patients, and there shouldn't be any patients left behind with not getting glasses or glaucoma treatment or low vision devices.
Yeah, exactly.
Thank you so much.
Thanks for having me.